Welcome to Destination Change, a podcast where we talk recovery, treatment, and more. I'm your host, Angie Fiedler-Sutton, with the National Behavioral Health Association of Providers. Our guest today is Ryan Hampton. Ryan is a nationally recognized activist and organizer. He's a person in recovery from addiction and the author of Unsettled and American Fix. A prominent speaker, author, media commentator, and panel participant, Ryan travels coast to coast to add solutions to our current addiction epidemic. A former White House staffer, he has worked with multiple nonprofits and national recovery addiction campaigns. This includes Mobilize Recovery. Welcome to Destination Change, Ryan.
Thanks for having me. Good to be here.
Now, for those who are familiar with the podcast, they know what I'm going to ask. Basically, just kind of how you got into the industry space, the addiction space itself. It says you're a person in recovery, but kind of that journey of what made you decide you wanted to help others.
Yeah, it's a great question. Thank you for asking me the question in the context of the beginning of my recovery journey, because typically sometimes I get asked, how did your addiction start? And that, I think that's a common question, but I like to talk about the journey more than I like to talk about, the cause, honestly. Mm-hmm. I didn't ever envision myself getting into recovery advocacy or even, quite frankly, being open and honest and talking about my story. And I had no desire to do that. My recovery date's February 2nd, 2015. And shortly after I got into recovery, I was actually living in a sober living home, really having no idea what I was going to do with my life, rebuilding kind of block from block at it felt like at the, ground zero at the very beginning. And I had a catastrophic nightmare of a time trying to navigate the healthcare space prior to getting into recovery through treatment and all sorts of issues. And when I ended up getting out of treatment into sober living, I was looking for a job and I ended up driving Uber and was just in this mindset of, hitting the reset button and starting over and not really knowing where that was going to take me. About 8 months into my recovery journey, I started experiencing something that's far too common, I think, in communities of recovery. And that is, the loss of people who are close to us. One night I had been recruited and trained to become the new peer house leader of the sober living I was living in. And one of my friends was the co-leader. And one night my roommate, Nick, had come home and he had had a recurrence of use and said, what do I do? I don't know what to do. There weren't many options on the table. It was like 9 p.m. at night and he was coming home from work. There were no recovery meetings that were going on. There was a rule at the house that he was going to have to leave. And it wasn't my rule, but it was the rule. And so a few of his peers, including myself, sat down on the deck outside the house and talked about it for a few minutes and tried to figure out, well, what do we do with Nick? And Nick didn't want to call home because his parents weren't talking to him. He couldn't go to treatment because he had no money. He had no insurance. He was terrified. He worked construction. He was terrified to call his work and let them know because he thought he would get fired. And the best idea that we could come up as a group was Nick should go to the hospital, which is, was only about a mile away from our house, and he could walk there. And so that's what we did. We sent Nick on his way to the hospital, and he got to that hospital and he waited and he waited and he waited longer. And he was there until about midnight is what the hospital documents say. He wasn't seen by a doctor. He wasn't triaged. He went in and he told them he needed help and he needed detox and that the sober living was going to let him back in as long as he detoxed there and got medically cleared, quote unquote. And the hospital didn't admit him. They sent him on his way with a white piece of paper with a bunch of crisis hotlines on it that he could call the next day. He died that night. Walking back to the house, he used again and overdosed and died. And I can remember crystal clear as day the next morning getting woken up by the owner of the house and circling us all up and telling us what happened. And then going on to tell us that this is just kind of something we have to deal with, that this is what happens. People die. He used kind of all the cliches in the book. And I can remember it was that moment when I was so upset. I wasn't just grieving. I wasn't just in shock. I was upset and angry and thought there's something that's not right here. Yes, people die, but it's not like he just died. Like he went to a healthcare facility, a hospital, not just any hospital, but like one of the best hospitals in the Southern California hospital system. And they have like something like $1 billion endowment for disease states there. And they turned him away and said they couldn't help him. It was at that moment, that day, that time, that I decided something was wrong and something needed to change. And so that summer, my best friend and I didn't know what to do. And we rented a 35-foot RV and we traveled the country and went to across 22 states and traveled something like 18,000 miles. And we crowdfunded our way around the country just to meet other people who were impacted. We stayed in homes of friends and family members who had lost loved ones. We went into jails. We went out on the streets. We talked to people who were using drugs. We went into recovery community organizations. We talked to peers. And we got back from that trip and realized that we weren't alone, that we had felt that a lot of people around the country felt that they weren't being listened to. And that's what started us or led us to start the nonprofit. While we didn't really know what we were doing at the time, and we started it with $20, literally $20, we knew that folks' voices needed to be heard. We knew that, an organized movement needed to come out of the recovery space. We knew that if more people who were directly impacted weren't just telling their stories, but were actually sharing their experiences and demanding some sort of change on the local level, whether it be through regulatory rulemaking or legislative or otherwise, that maybe we could turn the tide on this thing a little bit. To make a long story very short, I think the journey from there has made up of a whole bunch of small parts, right? People will say, well, how did you get to where you're at today? Honestly, it would take me 10 volumes of books to be able to tell that story, because they were all small things that happened along the way that led me down another path, that led our community down another path. And I think all of those small little turns and decisions, kind of add up to who I am today. And to fast forward in 2024, that idea of that nonprofit has now grown into a multi-million-dollar advocacy organization with nearly 70,000 members and active coalitions and, nearly 40 states. And we've passed hundreds upon hundreds of pieces of legislation around treatment, recovery, harm reduction, evidence-based prevention. We've run programs to recruit and train people for appointments to federal and state positions. We have folks who are training to run for office as people in recovery. We've gotten involved in Congress. We've gotten involved in state legislatures. We've passed sober home standards bills, which is something that we led from the beginning, and taking the NAR standards and really codifying them into state and federal code. These are all things that, this is like the power of the recovery community and really at the heart of Mobilize Recovery. But it's oftentimes not me, right? It's not a me thing. Mobilize Recovery was really an idea at the beginning. And it was an idea that what if, we organized our community, but what if we built more leaders in the recovery community, right? In order to make seismic change, you need more leaders, and you need those leaders to be trained up on how to effectively lead their communities. And we're not starting from scratch here, right? Like movements like this have existed for a long time on so many issues, whether it be healthcare or reproductive freedoms or social justice or HIV/AIDS. Communities of impacted individuals have stood up to systems and demanded change that better serves their communities. And in our case, it happens to be with probably one of the most, if not the most catastrophic health crisis of our time, which is overdose. And in order to stop overdose, we have to make sure we're supporting recovery. And so we kind of look at it both ways. And even today, in 2024, as we head into an election, we're hearing about addiction, we're hearing about fentanyl a lot, but are we really hearing about what we need to do to end it that's realistic? This is where I think, the nuances matter. And nuances are an important thing when addressing our issue. If you don't understand the nuances, you're not going to be able to understand the solutions that our communities need. It's not as simple as treatment. It's not as simple as some of the solutions that are being offered on television by politicians. It's a whole system of care that needs to be revolutionized. And I believe that until folks start to listen to the recovery community, and folks start listening to folks who have been in those shoes and who have been through those systems and who have fallen through those cracks and those that have succeeded, change will be very slow to come. So it's our hope through Mobilize and through our other efforts that we're inspiring new people to get involved, but also providing them the support to make, the needed system changes in their communities.
Well, that is a great segue into my next question in terms of getting people invested and all that. Our audience is kind of a wide range. We have everybody from regular counselors to CEOs, C-suite, to everything in between. So if someone wanted to become more active or be an advocate and whatnot, what is usually your piece of advice that you like to give people in terms of how to get involved?
Yeah, I would say the most important thing is be authentic, right? I think there's some people that get into this space with a lot of ideas, but they lose their authenticity along the way. And if you're not authentic, it's very hard, I think, to actually relate to audiences of folks, whether they be legislators or corporate CEOs or just, your next door neighbors on what needs to happen. And I would say to get trained up, advocacy and organizing is a craft. It's just like anything else. It's a craft. There are helpful ways of doing it and there are harmful ways of doing it. I think we've seen a mix of both in the last couple of years in this space, particularly. My best advice to folks would be to actually check out Mobilize Recovery. I mean, this is what we do. And they could go to mobilizerecovery.org. They could also check out the Recovery Advocacy Project, our sister organization, at recoveryvoices.com. We have a whole suite of tools for people to learn. But, my experience really, there are prescribed steps like anything else, right, on how to be an effective advocate. And really the first thing is like really mastering the art of your public narrative. People in recovery are famous for being great storytellers, right? Like we love sharing our story. We love, talking about our experiences, but the way that we share our stories in our own recovery settings sometimes isn't the same way, depending on the audience, that you should be presenting it to a group of folks kind of writ large in an effort to impact change. The craft of effective storytelling, or, through the context of public narrative, is really how are you expressing your values and your agency, where your agency comes from, to a group of folks, and then asking them to join you on some sort of walk towards some sort of needed change or sprint or whatever it may be. And I think our community is very in tune with the storytelling in the context of like what it was like, what happened, what it's like now. And sometimes that's not the best way. So, if people were saying how to become an advocate, I'd say the first thing you really need to learn is how to effectively share your story. And that's not just for people in recovery, that's for providers, that's for C-suite folks. And these are the same type of tools that they teach you in corporate leadership, right? Like you don't just walk into a boardroom and share a whole bunch of folks that you need something from, just your genesis story and how you created your company, right? No, you're going to ask them something to do. They're going to want to know where these values are coming from. They're going to want to know what you stand for. I think that would probably be the most important thing for folks to do. And then the second is like, how do you map power, right? Like, we have a lot of allies in the recovery community. We also have systems that, are fighting tooth and nail to make sure we don't, disrupt the system too much. And that comes sometimes in the form of companies or agencies like insurance companies, right? Like insurance companies love to see this space fragmented and disorganized because they end up being the winners of it. Large scale pharmaceutical companies. I mean, like there is a definite power dynamic in being a good advocate and knowing who your allies are and knowing, I don't want to say necessarily your enemies, but who's in opposition to you. Building community is another really important strategy. You can't really have a go it alone strategy. I think a lot of folks have attempted at this by themselves, singularly trying to build a platform. If you're going to be an effective advocate, you got to have a team that you're going to work with, a team that's also trained up and that you trust. There's wins and there are losses in being an advocate. And you need to figure out a way to celebrate both, honestly. You need to be able to celebrate your wins, but equally you need to celebrate, your losses and the attempts you made, because not everything you do is going to be accomplished or is going to be successful. So I think those are real key tenets. And, at the heart of it, being authentic and always keeping your eye on your true north, which should be the community you serve, has got to be, first and foremost. We've seen a lot of times folks jump into the space, get involved in recovery advocacy, and then use that and build a company. And it's not that there's anything wrong with that, but there's advocacy and then there's corporate building, right? They're two very separate things. And I know we've got providers and behavioral health folks on here. Thank you all for listening. I will say there's nothing more that drives me absolutely insane, and folks who are advocates on the ground, than seeing a treatment provider or behavioral health provider provide a business card, for someone that works for them with the title of recovery advocate. I believe that maybe a recovery navigator or something like that, but I believe the advocate title has somewhat been co-opted by the corporate space, which really has made our job, at the macro level a little bit harder because it gets confusing for folks. I like to say when you're like a recovery advocate, you're advocating for the community at large, right? Like you're not advocating for one particular company or one particular business model, if that makes sense.
Mm-hmm. Well, you mentioned storytelling as one of your resources. You have a couple of books. We don't have a whole lot of time left, but kind of give me your elevator pitches to what the books are about for those who may not be familiar with them, and kind of what prompted you to write something.
The inspiration to write both books were driven through just personal experiences I was going through. American Fix was my first book. It published in August of 2018. When I had gotten home from that cross-country trip and was just starting to get involved in the nonprofit space and the advocacy space, I remember I had gone to a bookstore in 2017 called Romans in Pasadena and was looking for a book about the addiction crisis, but not through the lens of like a journalist or a celebrity. I was really just kind of looking for a think tank book on like, what the solutions could be, what we could be doing. And I spent like 3 hours or so in that bookstore just looking, perusing all the behavioral health material and addiction, material, and had a really hard time finding that book. I found some great books by some people I really admire, but nothing that was really ringing true to what I was looking for. And I got home that night and I told my roommate the story and didn't really find the book I was looking for. And he's like, well, you should think about like writing something, like nothing like outrageous, but like, why don't you write something about the folks we met and the stories we heard and, the things that you saw and that we saw and what different communities are doing around the country. And I was like, that's not really a bad idea, but I've never written a book. I don't know how to write a book. And so, being that I'm in recovery and, when I don't know something, I ask someone, and the person that, not person, but the machine that was near me was Google. And I remember Googling, like, how do you write a book? And Google gave me I found my way to a blog that, gave me all the instructions of needing an agent, writing a book proposal, and how to write a book proposal and what the template looked like. And I went through all those steps and I ended up submitting the book to the 5 big publishers and just sending it off, the proposal off of this book that I wanted to write. Like, much to my surprise, 3 of them got back to me, and I ended up settling on Macmillan and St. Martin's Press and published American Fix. And American Fix is really, I like to think of it as like a beginner's guide to advocacy and what we could be doing to get us out of this crisis that we're in, if we only got out of our own way. It ended up being a bestseller shortly after it came out, and it really opened the doors for me to meet a lot of phenomenal people around the country who are doing even more than what I wrote in the book. I'm grateful I had that opportunity. The second book, Unsettled, actually came out as my experience as the victim's representative on the Purdue Pharma Bankruptcy Creditors Committee. I was appointed by the Department of Justice in 2019 to represent 120,000 victims in the Purdue Pharma bankruptcy. I was under all sorts of protective orders and not allowed to talk about my experiences, and conversations with the Sackler family and different attorneys general. And it was also in the height of COVID, so I was in lockdown. I had kept a journal of my experience because I was so frustrated, because what people were being told on the outside about what was happening was not really what was going on the inside. And I saw it as a grave injustice to our community and to family members and to folks who were impacted by Purdue's greed. And so I kept this journal. And shortly after the first round of the bankruptcy was gavelled and the bankruptcy plan had been confirmed, I resigned from the committee and then ended up deciding that I was actually going to publish my notes and my journal in the form of a book, and rewrote my journal in the form of a book because it was my opinion, and donated all proceeds to nonprofits from it. It was my opinion that if the injustice of the Purdue Pharma bankruptcy process was really not put out into the public and in the sunshine, that the same thing would happen again. And we have seen this go all the way up to the Supreme Court, where it's sitting right now for a decision, because a lot of us decided to get vocal about the injustices that we experienced. And then there is a third book coming in September of 2024. My third book will be published, titled Fentanyl Nation. And it's really a manifesto or an examination of how toxic politics is really taking us backwards when it comes to ending drug overdose deaths. That much unlike when I wrote American Fix, this is no longer very as much of a bipartisan issue as it used to be. We're seeing members of both parties, major parties, politicize the issue for political gain, and it's doing, folks on the ground no service at all.
Awesome. Well, we're getting close to the wrapping up. It's 2024. It is an election year. You already mentioned that once. Kind of your goals for the year, both just as yourself as well as Mobilize Recovery, and what you hope to accomplish.
Yeah, I mean, it's my hope that we're going to be doing a lot this year and more will be revealed. But I will say that it's my hope that more people in recovery and folks who are impacted get involved in this election. Politicians and elected officials, both in Congress and in our states, listen when we vote. I don't care if it's Republican, Democrat, blue, green, yellow, whatever color you might be, partisan wise. If you're not voting and you're not talking to your elected representatives about this issue and what's happening in your community, we end up getting a pat on the head and politicized for television commercials and political gain. So it's really my hope that this community steps it up a little bit this election cycle and gets more involved. It's not about who you vote for. It's about making sure who you support knows what needs to be done. We hope to be a part of the solution on that.
Awesome. Now, was there something that you were wanting to talk about that we haven't, or something that you thought I was going to ask but didn't?
No, I think we're good.
Great. Awesome. You already mentioned it a little bit, but briefly, if people want to get more information about you or about Mobilize Recovery, where can they go to find it?
Sure. Folks can go to www.mobilizerecovery.org. They can learn more about me and my books at ryanhampton.com, and also the Recovery Advocacy Project, our sister organization, at recoveryvoices.com.
Well, I could sit and probably talk to you for another couple hours, but unfortunately we're out of time. So you've been listening to Destination Change. Our guest today was Ryan Hampton. Thanks for being here. Our theme song was Sun Nation by Keatsa and used via Creative Commons license by the Free Music Archive. Please consider rating and reviewing the podcast on Apple Podcasts so we can get more listeners. In the meantime, you can always see more about the podcast, including show notes and where else to listen, on our website, www.nbhap.org. If you have any questions for the podcast, please email us at info@nbhap.org. Thanks for listening.